Okay, good.
So where do you work?
Yes, doctor. I'm working in Yemen at
Which part of Yemen?
Thawra Hospital in Sana'a.
In Sana'a. Is big
Mainly.
hospital?
Yes, it's Thawra Hospital. It's a general hospital and tertiary hospital, considered one of the biggest hospitals in Yemen.
Mhm. And how many neurosurgery beds do you have there?
At our department, we have about 40 bed and 6 ICU beds.
Very, very big,
So,
very big service. Very big service.
yes, it's considered big department, yes.
Mhm. And how many operations do you do every year?
Usually before we do many operations, approximately like 10, 12 operations per week. But in the last years, due to the unstable situations and the economy is not very good, so it's less work this times.
I see. And you also do pediatrics in as a part of your work?
Yes, we do also pediatric. We do construction of meningococcus, hydrocephalus, and such things. So we don't have a subspecialties yet. So we do all kind of neurosurgery, general neurosurgery, basically.
Very good.
Yes. In your hospital, doctor, you have many departments, neurosurgery, subspecialties, or just one big department?
In Turkey, there's a system where there are governmental universities, and there are also private universities. I work in one of the private universities. In this university, we have We mostly focus on brain tumors in adults, all pediatrics, spine, but there is nobody that is actively focusing on vascular or functional neurosurgery. So it is most likely, like most majority of what we are doing is tumors. And big service
looks much
again.
like our hospital.
Yes, it's about like 1,000 patients every year, and mostly adults and pediatrics.
So it's almost the same. As we don't have a functional and vascular, we don't have yet, because we don't have the equipment necessary for this.
I see one of our former fellows here. Nargisa is here. Regards to
Hello,
you.
sir. Hello, everyone.
How are you?
How are you,
It's a
Dr.
great
Nargisa? How are
pleasure.
you?
Hello, I'm fine, thank you. I just wanted to tell that I'm very glad that today Dr. Koray will be giving a talk, because I'm honored to be personally know Dr. Koray, and I even assist for surgeries and have seen how Sir was doing the polyclinics, morning rounds, and it's a great experience. Thank you, sir. Looking forward to listen to your talk.
Thank you very much. Nargisa was a pediatrics fellow at our department. She was an outstanding fellow, one of the best so far.
Oh,
Very
thank
good
you, sir.
neurosurgeon.
Thank you.
I think it's already time, so we can start. Doctor, I will do a welcoming for the audience and the introduction, and then we can start. Okay, Doctor?
Please. Thank you.
Okay, so welcome everyone to the second module of the comprehensive Yemeni neurosurgical educational course. In this module, we will focus mainly on the supratentorial anatomy of the cerebrum, and we will start today with two distinguished speakers. First, we have Dr. Koray Osman, Professor and Chair at the Department of Neurosurgery at Ekbidam University School of Medicine at Istanbul, Turkey. And he is also the founding member of the Brain Tumor Research Group at this university and performing basic and traditional science work. Dr. Koray today will talk about the general anatomy of the CNS. Doctor, please, you can start. And I hope I pronounce correctly.
Thank you very much for this kind introduction. My name is Koray Özduman. I come from Istanbul, Turkey, and I work at Acıbadem University, and I basically focus on brain tumors. Today, I am honored and privileged to share with you this talk as a part of the World Federation educational courses. Today, I'm going to talk to you about the general anatomy of the central nervous system. I'm going to start with actually two questions for you. The first of these questions is, does any one of you know why we call the frontal lobe the frontal lobe, and the temporal lobe the temporal lobe, and not something else? So
Your answer.
During the talk, you will learn about these small details, which will make the life a little more easier for you, and to understand why we are learning anatomy. What's the need for us to learn neuroanatomy in greatest detail, and to advance it every day even further, every day even further. So, as you know, the central nervous system, during its development, is made of four four different parts during the development. The first of these is the prosencephalon. And this prosencephalon part makes up the brain cortex and also the diencephalon. And as you know, the diencephalon will turn into the thalamus, hypothalamus, the pituitary, the posterior pituitary gland, the optic nerves, and will be developed into these portions of the brain. The mesencephalon will develop into the midbrain, as we know. The rhombencephalon will develop into the pons and the medulla, as we know it. But in general, these general terms usually do not tell you much about the function of the central nervous system. Therefore, I think it's a better idea to divide it into three portions. These are functional computational portions. The first and probably the most important, what makes us human, is the cerebral cortex. The second, very important part, which is lying underneath the cortex, is the white matter connections of the brain. And then at the very center, we have the central core. The central core is an automatic machine. It does not computate long functions or complex functions. It does not have behavior. It does not have language. It does not have the detailed functions that we attribute to a human. It primarily focuses on reflexes that keeps our body within the right homeostasis. So the sodium should be within normal limits. The blood pressure should be within normal limits. The blood circulation should go on, and the patient should be awake. And all these functions are automatically done by the central core. But the cortex is, again, like I told you, what makes us human. Therefore, this computational unit was in the focus of humans for a very, very, very long time. Now we should make a differentiation between two parts of the cortex. Today, we differentiate between allocortex and isocortex. In the old days, we used to call these paleo and archicortex, which made up the limbic part, and the neocortex. But it's a better nomenclature to call the neocortical part the isocortex, and the paleo and archicortical portions of the limbic system as allocortex. But then, again, you should basically divide the cortex into these two parts, the allocortex and the isocortex. First, we should start with the allocortex because it's better, easier to comprehend, easier to understand. Neuroscientists like surgeons and anatomists early on realized the importance of this limbic system as we know today. But the first person who named this portion of the brain was Thomas Willis. Willis told us that there's a portion of the cortex that lies around like a belt around the brainstem and the thalamus. So the central core of the brain. So the cortex that lies around the central core like a belt, he called the limbic lobe. Limbus means the lip or the surroundings, the belt that is surrounding the central core of the brain. Over the years, people started understanding more about the functions of this portion. The first of the researchers who started working on this portion was Paul Broca. Broca, as we know from the Broca's aphasia. Broca, in 1838, told us that the limbic cortex is mainly concerned about olfaction, about the smell. Then, in 1905, another German scientist, Christoph Jacob, realized that different portions of this limbic cortex, what they called the great limbic lobe by Broca, was very much interconnected between different portions. And these portions were again interconnected with the isocortical portions and also the brainstem. So he thought to himself, this must be playing an important role in the homeostasis of the body. Then you probably all know the name of James Pepys. James Pepys in 1937 described the Pepys circuit that is required to produce memories, to write new memories into our brain. Early afterwards, another Russian-born American scientist, Paul Yakovlev, I'm sorry about misspelling of the name here. The name is Paul Yakovlev, described in 1948 that the limbic lobe is also concerned about emotion. Early after him, Paul MacLean integrated all of these informations. This means this lobe is connected with smell. It induces our body to work harder to collect information about the location of food and to remember it. First to smell it, understand where it's located, and then to remember where you find your food yesterday. So Paul MacLean said all of these singular functions were all interconnected within the limbic system. After him came Marcel Mesulam. Marcel Mesulam is a very important neurologist who worked very much on language problems in human, defined these two areas, two belts of the limbic system. The first part of these belts he called the olfactocentric portion. The olfactocentric portion was the portion that Paul Yakovlev had described. And this portion is concerned about getting the smell and getting emotions about it, like getting hungry and maybe feeling the beautiful smell of the cookies that your grandmother has done for you from your childhood. So these memories should have an emotion related to them. He also described the second part, the hippocampus-centric portion of the limbic system. This second part, although it is connected to the olfactocentric part, was working on its own to develop new memories. And based on these, Marcel Mesulam also looked at the histology of these portions. He quickly realized that there were some phylogenetically older portions of the limbic system, and there were also some newer portions of the limbic system. He quickly realized that the newer portions of the limbic system were more associative centers. Associative meaning when an information comes to you from the piriform cortex about the smell, and then another information comes to you about your memories from your hippocampus. Then another information comes to you about your drive to have offspring and your drive to eat and drink water to continue your hemostasis. Somebody needs to gather all these information and associate them and come with a conclusion about it. So the newer portions, the more complex and phylogenetically newer portions, were actually the insula and the cingulate gyrus. And these portions were the most complicated portions of the limbic system. But very interesting, these portions resembled the isocortex, the old neocortex that we knew. But older portions of the limbic system were actually not as well developed. Let's look at the picture here from the substantia innominata, the cortical portions of the brain that are located just above the middle cerebral artery, where the anterior perforated substance is located, and this area we call the substantia innominata. And in this portion, you see that the neuronal bodies are haphazard. They're not organized. They're just lying around, just like in the nucleus of the brainstem or in the nuclei of the thalamus. So these look like nuclei rather than the cortical layers of the isocortex or the neocortex that we know. But the more complex functions these limbic portions were doing, the more complex the anatomy became. When you looked into the hippocampus already had 4 layers. The CA1, CA2, cornea monis 1, cornea monis 2, cornea monis 3, and the dentate gyrus. So 4 layers to it, as you're seeing on the upper right picture. But when you go to the insula or the cingulate cortex, you're seeing that these are those very closely resemble the isocortex that is located on the superficial portions of the isocortex. So these already had 6 layers. And when we look at the isocortex, towards the occipital pole where the vision function is located, you start seeing 8 layers of layerization. So the more complex functions you're doing, the more complex and the more orderly the anatomy becomes. So within the limbic system, Marcel Mesulam defined that these functions should go from very primitive to very complex. And he said to himself, the limbic areas are just next to the brainstem. As the name denotes, like these are the limbus, the belt around the brainstem. The belt around the brainstem gets the information about the internal milieu. Like this means your sodium content, so the water content in the body, your need to feed yourself, the need to produce offspring. So these very basic functions were already coming from the central core of the brain. But the limbic system, with the olfactory cortex, the piriform cortex, was getting the smell information. With the hippocampus, it was getting the memory in addition to it. The amygdala was giving the orders to go and feed yourself, to go and eat. So these informations were driven to the paralimbic areas that you're seeing here. And the paralimbic areas I'm telling you are basically the insula and the cingulate gyrus, the more complex, the more associative parts of the brain. So this means you get simple information and feed it into higher order, more complicated, more associative information. The same should also exist for the isocortex, Marcel Mesulam said. Okay, he said this, but what did we know? In the early days, we realized that the isocortex or the neocortex should have a similar organization, but we did not know much. In 1838, this anatomist that you're seeing on the picture here, Friedrich Arnold, said that we should call the lobes of the brain, these anatomically and functionally cohesive areas of the isocortex, based on the bone that's overlying them. So we call the frontal lobe because it lies under the frontal bone, thanks to Arnold. And then you call the parietal lobe the parietal lobe because it lies underneath the parietal surface bone. So based on the suggestions of Friedrich Arnold, we started calling these neocortical areas based on the bone that overlies them. But this did not give us much information about the function. One of the first names, again, to work on the function of the isocortex was, again, Paul Broca. in one of his patients, he saw the patient became abruptly unable to speak, unable to express himself, and unable to speak out. He followed this patient for some time, and the patient died, and he did the autopsy and reported the results of this autopsy to the French Academy of Sciences. In the French Academy of Sciences, there were two things that he was saying. First of all, and most importantly, he said, speech is lateralized. Speech is located on the left side of the brain. Speech is localized on the left side of the brain. The second, less important, but more important for us here, information was saying that the inferior portion of the frontal lobes is concerned about the speech. So now we had an idea that the frontal lobe might be doing some speech function. Sometime after him came Carl Wernicke. Carl Wernicke told us that the posterior temporal lobe, superior temporal gyrus, posterior portions of the superior temporal gyrus, were taking a very important role in understanding. They were taking a part in language, but understanding part of the language. So now we had an idea that the temporal lobe might be doing a function about speech. And then people started working very, very hard to understand the function of different portions of the isocortex, of the neocortex. First of all, by looking at its neuronal anatomy. We call this cytoarchitectonics. Cytoarchitectonics means the architecture of the neurons located in this area. The first one is very, very famous. Everybody knows the name of Corbinian Brodmann. From Brodmann, we learned that the brain is not a homogeneous, does not have an homogeneous isocortex. Different portions of the cortex do have a different anatomy. And then this was again supported by the work von Economo several years after him. Economo went into more detail, did a more elaborate map of the brain neocortex. These two researchers, both Brodmann and von Economo, were actually the pupils of Cecil and Oskar Vogt. The Vogt family was a German family and is a very, very influential family in understanding the brain anatomy. Here you see Brodmann with them. Von Economo is here not with them, but in their small laboratory outside Berlin, they started looking at this cytoarchitecture first, but then they thought to themselves, oh, the connections of these neurons might be also of importance. Therefore, we should also look into how the myelin is located in different portions of the brain. So they also did a myeloarchitectonic map of the brain. So with these two maps, we started knowing more about the anatomy of the brain on the surface. Then came a neurosurgeon. In the 1930s, this Canadian neurosurgeon, Wilder Penfield, published in the very, very famous Brain Journal. This is a neurology journal, an English neurology journal. His works on the electrical stimulation of the brain cortex. And he quickly realized that the portion that is concerned about the motor functions had this homunculus configuration. Homunculus configuration means a somatotopic map of the functions that you're seeing here. So he described that the parasagittal portion was concerned about the movement of the feet and legs. The central portion was concerned about the function of the fingers and the hands and the arms. And the lowest portion was concerned about the functions of the mouth. Penfield got the Nobel Prize with this discovery. And he told us that this is a very, very important function of the motor cortex. But his work was not imperfect. People quickly realized that this homunculus was incomplete. The homunculus was a mosaic, had a mosaic distribution. In cats, you're seeing the example here, that the hip is located here, hip is located here, hip might be located here, hip might be located here. So it is not a continuous map of an homunculus. It has small portions that are doing functions that are related to each other. So this is called a mosaicism of the neocortex. And then an American researcher named Mountcastle told us why this is so. So this is probably one of the most important portions of the talk today. Mountcastle told us that the basic computational unit in the brain, is not the neuron, but a collection of neurons organized in the form of a cylinder. So he called these cortical columns. And in 1957, he described that each of these cortical columns does a very, very specific functions. We have thousands of these cortical columns doing thousands of different computational things, but in a very, very minuscule portion of the cortex. So this tells us why we do have mosaicism. The cortex is not like a football field that goes from one part of to the other. It is made up of cylindrical computers that are sitting on the surface of the brain, and each one doing a different function. But then, because each of these computers need to be connected to each other, we had to learn more about their connections. And these connections came with the help of anatomists and neurosurgeons alike. The first one was Joseph Klingler in the 1950s. And Klingler invented the fiber dissection technique. The fiber dissection technique you are seeing on the left side. We know this very, very well today, because we see it every day in our surgical publications. This came with the help of these three people. Joseph Klingler came out with the fiber dissection technique. Professor Yaşargil, who was one of the pioneers of neurosurgery, who brought the microscope to the operating room, quickly realized that this was very, very, very important, and himself started working on the subject. And his pupil, Professor Ture, popularized this once again as a neurosurgical technique for understanding of microanatomy. So today, with the help of this fiber dissecting technique, we know that the connections, the white matter connections of the brain in much, much more details. From Maynard before, in the 19th century, we had known that there were three types of them. Projection fibers that are connecting the cortical parts to the parts below. We knew that there were commissuration fibers connecting the two hemispheres, to the left, to the right. And then there were the association fibers, which were connecting each lobe within each other. But today, we know that they are functionally very important highways of connections inside the brain, and these can be divided into like almost 20 different connection pathways on both sides of the brain. It didn't stop there. We learned that these connections could bring two portions of the brain together. Then we went back to the map that Marcel Mesulam told us. So you have, in the limbic area, we spoke about primary functions like what the amygdala does, what the hippocampus does, what the piriform cortex does. But then there were association areas, paralimbic areas, like the insula and the cingulate gyrus that were bringing those informations together and associating them. Like this, Mesulam told us that there were primary isocortical areas, primary sensory and motor areas, like the primary sensory area or the primary visual area or the primary hearing area, the Heschel gyrus here that you're seeing here. Each of these portions is getting one single information into the brain. It gets sensory information, it gets hearing information, it gets visual information, but it gets one single type of information. Then in the neocortex, we have modality specific. This means unimodal, one single mode, association areas. So the cortex around the primary visual area, the visual association areas, do one function. They look at the shape of what we are seeing, or the color of what we are seeing, or the motion of what we are seeing. So these are encoded into information. And then a higher order heteromodal association areas bring those together. The yellow roundish thing that you're seeing is the Volkswagen of your grandfather. And higher association areas bring those together again with the limbic system here that you're seeing here. And when you bring them together, you're seeing something yellow that moves from one part of the street to the other part of the street that is half a sphere. Then you say that this is a yellow Volkswagen. And then you understand that this Volkswagen used to be like the Volkswagen of your grandfather. And you remember good memories about your grandfather, how you traveled to different places, sitting in that car together with your grandfather, going into the memory parts. So this means that different parts of the brain come together to associate the information that they have gathered in the beginning. So these are higher order heteromodal association areas. It didn't stop there. In the early 2000s, it was very well established. It started in 1980s, but then it was very well established in the 2000s that the vision information was not going into one place only. There were two streams, two streets that were carrying that information. One part was carrying the information to a what cycle. So you were seeing something, and this cycle, this stream was telling you, what is this? The yellow Volkswagen. And the other part is the where stream. The where stream tells you how to interact with what you're seeing. This means, is the car coming towards me? Do I have to jump to the side of the street so I don't get run over? How far is the car from me? How quickly is it coming to me? So this gets you the information about where. So this means the Mishkin and Unterglider theory, the dual stream theory, was saying to us that the vision was going into two different streams. Over the years, we learned that the same is true for language. Hickok and Popple in 2007 said that there's a dual stream also for language. How is this so? They said that there's a ventral stream. The ventral stream is located on both hemispheres. It's mostly located in the temporal lobe, and it's concerned about understanding what is spoken to you, or what you're seeing in your vision, or what you're hearing in your ear, what is spoken to you. So with all of these informations, you can get a ventral stream. And this ventral stream helps you for your inner thinking, what you're thinking without speaking to other people. This is located mainly in the temporal lobe, and basically uses the inferior frontal or fronto-occipital fasciculus, the inferior longitudinal fasciculus, and the uncinate fasciculus to bring the information from the parietal lobe, from the occipital lobe, and from the lower temporal lobes through the temporal lobe to the Broca's area on the left side of your brain. But there's a second stream, second connection, second street that goes through the brain. And this is called the dorsal stream. And this dorsal stream brings the information about how to speak, how to repeat this. So with this theory, the Broca's area, the Wernicke's area, or the terms that we know as Wernicke's aphasia or Broca's aphasia, these became history. Today we know how the cortex is working and which parts of the cortex are taking part in this function and what white matter connections are taking part in this function. Therefore, whenever we see a lesion or a tumor inside the brain as neurosurgeons, now we know how the speech, how the language might be affected by this, because we know what the cortical areas are and what their connections are and how our tumor relates to those areas. And we know these connections by studying neuroanatomy. Over the years, people started getting this information also in live people, without having to do a dissection, without having to do an anatomical dissection. They came out with functional MRI. And then somebody realized that the functional areas in the brain get co-activated. If you activate the motor cortex on the left side, the motor cortex on the right side is also activated together with it. And this co-activation of different portions of the brain at the same time brought us to the point for us to develop a machine called the technique called resting state MRI. This resting state MRI gets a functional MRI of the brain for hours and hours, for long hours, maybe for 6 hours or 9 hours, for a long period of time, then makes associations between two parts of the brain and gives us information what functions might be working together. With the help of these, we understood that there are functional networks in the brain. One of them was the connection I was telling you about, the speech, somotomotor, the speech network. Then you have a visual network that is concerned about the vision. Then the somotomotor network, which is concerned about our motions. Then attention network, a default mode network that is active while you're not doing anything. So this means we came from a very primitive understanding of the neocortex, where we thought that there was only one area for speech or one area for motor function, to a point where we know that each function, like language, like speaking, like attending to something or doing something or controlling something, these are all distributed inside the brain. They are not localized to the brain. So we switched from a localization type of understanding of the cortex into a large scale network. Finally, another very important neurosurgeon, Hugues Dufaux, you're seeing the picture here, taught us that different portions of these large area networks are also speaking to each other. So they are coordinated with each other. Like the visual functions that are coordinated with each other, these different functions like speech, language, attention, all of these are also interacting with each other. So he came with this theory that he calls the meta-network theory. Let me explain you this in a little more detail. I'm sure you're going to understand it very clearly. We have inputs that Marcel Messelam told us, like the visual input, seeing something, the somatosensory input, touching something, the auditory network. The auditory network hearing something and understanding what's going on. And then the limbic system gives us information about if we're thirsty, if we need salt, if we're hungry. All these informations are coming. This information is fed into the networks that I just told you. These are working memory network, language network, semantic network. Semantic means what is this called? Like this is a pair of glasses, the pair of goggles, and the name for it means it's semantic. Then our emotions, social cognition, social understanding of each other, and then attention network. All of these single networks are spread around throughout the brain. And then these networks that you're seeing here, the spatial cognition, working memory, language, semantics, are talk to each other, interact with each other, and they interact with each other context sensitive. So when you're speaking and trying to retrieve words while you're speaking, you need to interaction of this language network with the semantic network. And if the language is telling you a love poem, then you get emotions. And then the emotions need to be interconnected with the language and the semantic network. And then you have to remember those. So they need to go into the working memory. So these get integrated. And after the integration, after these came out, we try to interact with the surrounding using, again, like these distributed networks that are distributed around the brain. And we create the outputs like motor functions or speech or painting something or writing a poem, things like these. So if you ask me, what is the brain? The brain is an association machine. By creating associations, it creates coordinated responses. We think what we have to do from inner and outer stimuli. Thank you very much for listening to me.
Thank you very much, Professor, for this fantastic presentation and this very informative lecture. And we have learned a lot through this presentation. Thank you very much.
Thank you very much for your kindness.
Professor Salman.
Thank you very much for taking your time and listening to me. I'm very honored to be with you tonight. Thank you for being with me.
Thank you very much.
The honor is ours.
Thank you very much, Dr. Koray, for the great presentation. It's enormous amount of information for the short period of time. I just want to give a comment. We are so easily prescribing, functional MRI, different types of MRI or different types of investigation for our patients. But in times, we have to come back to the history, to evolution, to understand how much time it took for a lot of people before us to come back for this easy prescribed, like moments like we are doing now. And thank you very much. I learned a lot personally. Thank you.
Koray, I think wonderful. I really enjoyed that. History is amazing, and and to see it so fluently coming from you was excellent. Thank you for your talk.
Thank you, Professor Sharif. Thank you. I'm honored for your presence. Thank you very much.
Thank you.
So Salman, you can take the lead.
So I'd request Afifa Afsar, who's my senior resident, to start the talk. Afifa, can you please open up your video too? Thank you.
Hello, everyone. Can you hear me?
Yes, we can. We can start.
All right. So the topic that we'll be discussing today would be cerebral anatomy of the frontal lobe. And so without further ado, we'll be starting. So as we all know that all the hemispheres of the brain basically have certain surfaces. So we have basically a lateral surface, a medial surface, a superior view, an inferior view, which is also called as the basal surface. So to begin with, we have the lateral surface, and the lateral surface of the frontal lobe primarily
your
constitutes.
slides are not going forward, so maybe you just need to first of all do a
Presentation mode.
yeah.
Is it?
If you can make it first in the full screen mode, because now we see the PowerPoint screen,
Just
but we
make on
don't see it in full
presentation mode. Yes.
Yes.
So if you click below that,
Mhm.
no, the presentation mode is down on the right next to where it says 81. Yeah.
Yes.
Yeah.
Yes.
Is it okay?
No, it's still not there.
Maybe if you can
Maybe-
exit the screen sharing and share again.
Please share again, and that would work again. So exit the screen share, and then yeah, that's better.
Yes.
So
Excellent.
yeah.
All right. So we were talking about the lateral surface of the frontal lobe. And when we talk about the lateral surface, so the primary three structures that we appreciate on the lateral surface of the frontal lobe include the superior frontal gyrus, and then we have the middle frontal gyrus. So the superior frontal gyrus and the middle frontal gyrus are separated by a superior frontal sulcus. Then we have the inferior frontal gyrus. So the middle and the inferior frontal gyrus are basically separated by an inferior frontal sulcus. So on the lateral aspect of the frontal lobe or the cerebral hemisphere, if we talk about the frontal lobe, so we have primarily two sulci constituting the frontal lobe and three primary gyri, which is the superior, middle, and inferior. Then coming to the inferior frontal gyri, we basically have three prominent parts. So we have a pars orbitalis, which is going to be covering the overlying orbital roof. Then we have a pars triangularis. This is the inverted triangular structure that we can appreciate here. And then we have a pars opercularis. So part of the pars opercularis and triangularis primarily constitute on the left side of the brain, the primary motor speech area. So this is the primary aspect that we can appreciate. Also going further, extending posteriorly, we can appreciate that this is the central sulcus. Anterior to the central sulcus is the whole of the frontal lobe primarily, and we have and we can appreciate that the central sulcus is one of the sulci which does not meet the Sylvan fissure completely on the lateral aspect. So anterior to it is the precentral gyrus, which is the primary motor strip, and posterior to the central sulcus is the postcentral gyrus, which is the primary somatosensory cortex. So this is about the lateral surface. Then going on to the anterior view of the same. So we can appreciate when we're looking at from the top. So we can appreciate that there is an anteriorly we have the frontal lobe, frontal pole, and primarily we can see that this is the superior frontal gyrus, again being separated from the middle frontal gyrus via a superior frontal sulcus, and then we have the inferior and the middle frontal gyrus being separated by the inferior frontal sulcus. Here we can also appreciate on the lateral aspect the Sylvan fissure and the temporal pole and the temporal lobe that can also be appreciated. So this is basically, I'll take you through different views of the cerebral hemisphere in order to get yourself acquainted with the fact that how the lobe is going to look like from different views. Then you have a superior view again. So we're looking right from the top. So we can here now appreciate anteriorly we have the frontal pole and posteriorly we have the occipital pole. And dividing the two cerebral hemisphere, we have the longitudinal cerebral fissure that we can see in the midline. So again, just towards the vertex on the topmost area is your superior frontal gyrus. Then again, it is separated from the middle frontal gyrus by a superior frontal sulcus. Then we have the middle frontal gyrus, which we can trace all the way. And then middle and the inferior frontal gyrus is being separated by the inferior frontal sulcus. So again, revising it. So we have two sulci and three gyri that primarily involve the frontal lobe. Then this is, as we were talking about, the inferior or the basal surface of the frontal lobe. So we're looking from the inferior aspect. So here we have a different anatomy. So the medial most aspect is basically the gyrus rectus. And the gyrus rectus is actually separated from the orbital gyri via an olfactory sulcus. So why is it called an olfactory sulcus? Because basically olfactory nerve roots, they actually travel in between this. And posteriorly, these olfactory basically they divide into the medial and the lateral lamina. Then we can also appreciate that on the inferior surface, lateral to the gyrus rectus, we have this orbital gyri which are present. And further, when we go towards the cadaveric views, I'll be able to tell you. So basically, we have the medial orbital gyri, posterior orbital gyri, inferior orbital gyrus, and we have the lateral orbital gyrus. So basically, this basal surface of the frontal lobe is going to be constituting about the orbital gyri and gyrus rectus. Coming to the medial surface of the frontal lobe, so we trace the superior frontal gyrus on the medial aspect as well. So extending all the way from the basal, like the inferior most aspect, going over towards the top. So we have this is appreciated as the superior frontal gyrus. Superior frontal gyrus is separated via the cingulate gyrus, via in between by the cingulate sulcus. And the cingulate sulcus, we can trace it back all the way and this tends to go again towards the convexity as an ascending ramus of the cingulate sulcus, which tends to divide the paracentral lobule. But the paracentral lobule is basically a continuation of the pre and the post central gyrus on the medial aspect of the brain. And then we have posterior to the ascending ramus of the cingulate sulcus, we can appreciate the part of precuneus, which is again the part of the parietal lobe. So all the structure that is lying anterior to it is going to be constituting the frontal lobe. And this posterior to the ascending ramus of the cingulate sulcus, we basically have beginning of the parietal lobe. Now, coming from top to bottom, so we have the superior frontal gyrus, which is the topmost structure on the medial aspect. Then we have the cingulate gyrus. Both of them are separated via a cingulate sulcus. Then the cingulate gyrus is separated from the corpus callosum by a callosal sulcus. And inferior to it, we have a corpus callosum. Corpus callosum is basically going to be bounding the frontal horn as well as the body and roof of the lateral ventricle. So here we can appreciate that this is the lateral ventricle, this is the body of the corpus callosum, this is the genu, and the basal surface. The basal surface is going to be the rostrum of the corpus callosum is going to be forming the basal part of the frontal horn of the lateral ventricle. So this is what is of utmost importance here. Secondly, we can also appreciate here there is this para-terminal gyri and the para-olfactory gyri. So they are basically going to be just bounding the inferior most aspect of the rostrum of the corpus callosum. So this is basically areas which are right in close proximity to the anterior perforated substance, and this you can actually appreciate on the medial most aspect or the inferior or the basal surface of the cerebral hemisphere. Now, this is the cadaveric section. So this is like a brief, quick, short kind of a review. So this is the lateral hemispheric surface that like we all can appreciate. And this is the famous Sylvian fissure that actually tends to separate the frontal lobe from the temporal lobe. And we can trace it back all the way back. This is the pre-central sulcus. Sorry, this is the central sulcus, because like I discussed earlier, that the central sulcus does not meet the Sylvian fissure all the way on the lateral aspect. And the gyrus that is going to be lying anterior to it is going to be labeled as pre-central gyrus. And the gyrus lying posterior to this sulcus is basically the post-central gyrus. So this is the sensory area and this is the motor cortex. Then we have the pre-central sulcus, which is basically the continuation.
Afifa, just 1 second.
Yes.
Ahmed, Afifa, can you unshare and share again, and then we can remove these things from the thing. And whoever it is, please do not write and do not, Ahmed, please do not allow anybody to be able to use marks. So whoever is doing it.
I don't know how to do that, so.
So there's one of the Muhammads are doing it. So first name was shown there. So, but we can't remove all of them. So I think next time we see it, then we'll have to remove whoever it is.
Okay.
Try not to disturb, please. Okay, you can restart, Afifa.
All right, so we were discussing about the pre-central sulcus. which we were talking about, that basically, like we previously discussed, the portion of the inferior frontal gyrus. If we locate, this was the pars opercularis on the inferior most aspect of the frontal lobe. So the continuation, the sulcus that is running just that we can trace it all the way towards the top, is basically going to be our pre-central sulcus. And then we have the area which is posterior to it is going to be pre-central gyrus. And this is the central sulcus, which we can trace all the way towards the top again. And why we call it the central sulcus? Because here we can appreciate that this sulcus is the particular sulcus that is not meeting the Sylvian fissure here. And this is relatively thicker as compared to the post-central sulcus. Also, the area... Hello? Yes?
Sorry, carry on. Somebody must have opened their mic.
Yeah, so the area that is beneath the central sulcus is basically called as the subcentral gyrus. So this is a small part of the lobe that can be appreciated, and this is going to be housing both the fibers, that is the area of the post-central gyrus as well as the pre-central gyrus. And that is why this is called as combinedly as subcentral gyrus. Yeah, next. So this is the post-central gyrus. Like we could appreciate, this is the central sulcus, post-central gyrus, and this is the post-central sulcus. Then this is the area that we were talking about, that this is the frontal lobe. So we can see this is the inferior frontal gyrus, this is the middle frontal gyrus, and the topmost is your superior frontal gyrus as highlighted. Again, this is the superior frontal gyrus for all the beginners, so that they're able to identify. This only highlighted area is complete, just the superior frontal gyrus. Then coming here, so relatively thicker is your middle frontal gyrus. And then we come to the inferior frontal gyrus. Like we said, the area housing the orbital roof is pars orbitalis. The inverted triangle is pars triangularis. And then we have the pars opercularis. So these are the three components of the inferior frontal gyrus. Then we have the pre-central gyrus, which is the motor strip. Then we have the post-central gyrus, which is the primary somatosensory cortex. This is the subcentral gyrus, like I was talking about. That is the area beneath the central sulcus and having fibers or the portion of the post-central as well as the pre-central gyrus. So that is why it is called as the subcentral gyrus. Then we have a structure called as central lobe or paracentral lobule. So if you trace the pre-central gyrus as well as the post-central gyrus on the medial most aspect of the lobe, so that is labeled as the paracentral lobule. So here we trace, this is the homunculus of the brain, and this is going to give us an orientation that how the motor and the sensory fibers are oriented. On the medial most aspect, we have the area of the lower limbs, and on the lateral cortex, we tend to have the area of the hand, the body, and the face primarily. So the facial fibers are going to be lying further inferior, and then we trace them back. So they house then the primary hand area is basically the largest and which is present over the convexity, and then we can trace the homunculus back all the way to the trunk and the body. However, the lower limb or the leg area is primarily on the medial aspect. Again, this is just an orientation for the beginners, that the primary motor cortex, that like we talked about, is constituting the precentral gyrus. So the homunculus is more or less oriented in the same manner for both the sensory as well as the primary motor cortex, depending upon the areas and depending upon the sensitivity of the areas, the area is involved. Now we have the premotor area. So part of the pars opercularis, that is the portion of the inferior frontal gyrus, as well as the middle frontal gyrus, is basically constituting the premotor area. Premotor area is primarily one of the areas which is predominantly involved in motor planning of all the activities. So initiation comes and planning primarily comes from the premotor area. So it's important to know that part of the pars opercularis as well as the middle frontal gyrus is the primary constituents of the premotor area of the brain. And then this is again a cadaveric section. So here we can see this is the Sylvian fissure. This is the inferior frontal gyrus. So again, quick review. This is the pars opercularis. This is pars triangularis. And then the area over the orbital roof is pars orbitalis. This is the inferior frontal sulcus separating the middle frontal gyrus and the inferior frontal gyrus. And this is the subcentral sulcus, like we can subcentral gyrus, that is lying just beneath the central sulcus and over the top of the sylvian fissure. Then removing the lateral aspect of the brain, going towards the medial aspect to give an orientation. So here we can appreciate that the superior frontal gyrus can be traced back on the medial surface as well as the topmost entity. And then superior frontal gyrus is going to be separated from the cingulum via a cingulate sulcus. And then the cingulum is separated from the corpus callosum via callosal sulcus. And then corpus callosum, like we know, actually tends to surround the frontal as well as the body of the lateral ventricle. So it traces it back all the way till the splenium of the corpus callosum. This is a section with all the cortical branches that can be, this is again a lateral surface of the brain, and this can be appreciated that here we can see the superior sagittal sinus, which is running all the way in the midline from the frontal pole all the way back to the torcular heterophyllae, which is a confluence of sinuses. And also we can appreciate that these are the cortical branches, the venous as well as the arterial branches that supply the frontal as well as the temporal area, which are the branches constituting the anterior cerebral artery as well as branches from the middle cerebral artery. Then here we can appreciate, this is like we were talking about the superior surface. So here we can appreciate that on the middle, in the middle middle aspect, the superior sagittal sinus, we know, okay, on the central side we have various venous lacunae that are present on the either side of the sagittal sinus that can be appreciated. And here we can again trace the superior frontal sulcus and the inferior frontal sulcus, which is going to be dividing the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus here. This is the posterior aspect, and here we can see the confluence of sinuses, and again the superior sagittal sinus that can be traced all the way back. And again on the convexity we can appreciate the superior frontal gyrus, then we have the middle frontal gyrus, and the inferior frontal gyrus is going to be on the inferiormost aspect. Coming to the medial hemispheric surface of the brain. So this is a cut section that we can appreciate. So here we have kept the area of the pre and the post central gyrus intact in order to give an orientation that what lies further deep to all these structures. So this is the fork cerebri, which tends to separate the two hemispheres, and we can appreciate that just deep to the post and pre-central gyrus, interior to it actually lies the frontal horn of the lateral ventricle. Like we discussed, that the frontal horn of the lateral ventricle is actually bounded all the way from the basal to the anterior wall, as well as the roof is basically bounded by portions of corpus callosum. So the basal surface is going to be bounded by the rostrum of the corpus callosum. The interior aspect is basically, anterior wall is being formed by the genu of the corpus callosum, and then the body of the corpus callosum tends to form the roof of the frontal horn of the lateral ventricle. And superior to the corpus callosum lies the cingulum. So both of them are actually separated in between via a callosal sulcus, and cingulum is again separated from the superior frontal gyrus, which is the medial continuation of the topmost gyrus on the medial aspect via a cingulate sulcus. So this is just an orientation, for the orientation purposes, the deeper structures what lie on the middlemost aspect we are able to know and appreciate. And this is a similar picture. Again, we can appreciate here the cingulate sulcus. This is the superior frontal gyrus. This is the cingulum. This is the corpus callosum, and this is the callosal sulcus, which actually houses the pericallosal arteries. Again, like what we discussed previously, to give a brief overview, this is the cadaveric view. Here we can see this is the cavity of the lateral ventricle. This is again the corpus callosum. So like we said, like I told you, that the basal surface is being of the frontal horn of the lateral ventricle is bounded by the rostrum of the corpus callosum. This is the interiormost wall is going to be formed by the genu of the corpus callosum, and this is the body which is going to be forming the roof of the frontal horn of the lateral ventricle. Above it is going to be a cingulate gyrus, and the cingulate gyrus can actually be traced all the way to the inferiormost aspect and the basal aspect of the corpus callosum in the formation in the form of para-olfactory gyri and the para-terminal gyri, which basically lie in close proximity to the lamina terminalis. The down is going to be the lamina terminalis, which is going to be a continuation of the anterior wall of the third ventricle as well. Similar picture showing similar anatomy again. Then Yeah, so this was an orientation in order to identify on the basis of radiology. So this is an MR cut section, like we appreciate. And what is important to know, the primary most structure that we need to identify is basically the central sulcus. So here we see that there is a characteristic hand knob sign, which is characteristic of the central sulcus. The area that is lying anterior to the central sulcus is the precentral gyrus, and it's primarily the motor strip. So the significance of this hand knob sign or identification of central sulcus is important in order to delineate the motor cortex. And like we can say again, because it's a cut section, which is an axial section all the way from the vertex and right from the top. So this, we can appreciate that this superior most aspect is the superior frontal gyrus, and this is the superior frontal sulcus that tends to separate and that does not come in the midline. This is and the gyrus that is lying anterior to this hand knob sign is basically the motor strip or the pre-central gyrus, and posterior to it is going to be the motor cortex, which is the post-central gyrus. This is like a review. This is corpus callosum. This is the cingulum. So in between both of them is going to be cingulate sulcus, callosal sulcus, sorry. And this is the cingulate sulcus, which is dividing the superior frontal gyrus and the cingulum. This is the paracentral lobule, like we discussed, that it is the continuation of the pre and the post-central gyrus on the medial aspect of the cerebral hemisphere. Then this was the basal hemispheric surface, like we were talking about. So this is like the hemispheric, basically half of the cerebral hemisphere that you can appreciate. So like we talked about, the medial most aspect is gyrus rectus, and the gyrus rectus is separated from the orbital gyri by an olfactory sulcus. Why do we call it an olfactory sulcus? Is because the olfactory sulcus tends to house the olfactory tract, and the olfactory tract can be traced all the way back just anterior to the middle anterior perforated substance as lateral olfactory stria and the medial olfactory stria. So this is going to be housing the olfactory nerve roots, and that is why it is called as the olfactory sulcus. Lateral to the olfactory sulcus is the orbital gyrus. So this is the medial orbital gyrus, and anterior is the anterior orbital gyrus. Here is the lateral orbital gyrus, and this is the posterior orbital gyrus. So these all four gyri are actually separated by various sulci, which tend to have an H-shaped kind of an orientation. Like if we appreciate, so this is like an anterior part, this is the posterior part, and this is the lateral. So this roughly is going to be making an H-shaped kind of an orientation that tends to divide the orbital gyri, which are forming the basal most surface of the frontal lobe into anterior, posterior, lateral, and medial. Again, like with the complete view. So this is the gyrus rectus. Gyrus rectus being separated from the orbital gyrus by an olfactory sulcus. The olfactory sulcus housing the olfactory tract, tracing it back, lateral olfactory stria and medial olfactory stria anterior to the anterior perforated substance. And here we can appreciate that this is the medial orbital gyri, this is the anterior gyri, this is lateral, and this is the posterior orbital gyri. Again, why this is important to know, because this is the basal most surface, and deeper to it is going to be, if we could trace the white matter tract, so deeper to it is going to be the frontal horn of the lateral ventricle, like we discussed, because frontal horn tends to it basically houses the frontal horn is basically the inferior most aspect, and houses basically the inferior most aspect of the frontal lobe. This is a similar picture, so we can see the cut section. This is the rostrum of the corpus callosum, which tends to form the base of the frontal horn of the lateral ventricle. Then we can trace the lateral to the frontal horn is the head of the caudate. And if we trace it back, so we have the lentiform nucleus, which is again going to be the caudate, and the lentiform nucleus is going to be divided by the anterior limb of the internal capsule. So this, when we go towards the core gray matter. Then coming to a brief radiological anatomy, because when we talk about frontal lobe, so the important radiology that we need to identify, like we discussed earlier on as well, is primary orientation of to how to identify the central sulcus. Why central sulcus is important? Again, because anterior to the central sulcus is the motor strip, and it is important that we are able to identify the motor strip so that we're able to identify the lesion. Then, depending upon it, the different different kind of deficits or different kind of neurological what do you call it, the neurological manifestations that the patient is suffering from, we're able to appreciate, and the areas of involvement. So here we see that this is the characteristic hand knob sign like we were talking about. So this is an axial section of the brain, and this is an MRI image like we can appreciate. So the hand knob sign is, why is it labeled as a hand knob sign? Because like we talked about earlier while we were discussing the homunculus of the brain, that the hand is the area which is present on the vertex, and it is represented as on the vertex, and this is primarily the area that occupies like a major chunk. So because of its orientation, that is why it is named after it, and it's also called as an omega sign because it's shaped like an omega, and or it is called as the hand knob sign. So this is primarily the orientation or the representation of central sulcus on the radiology, and anterior to it, the gyrus that lies is basically the pre-central gyrus, which is constituting the motor strip, and the gyrus lying posterior to it is the post-central gyrus, which is comprising the primary somatosensory cortex. This is called the marginal sulcus. Why do you call it marginal sulcus? Because this is the continuation of the paracentral and the precentral gyrus when they are when they are reflected onto the lateral aspect. So this is the continuation of that. So here we can appreciate that this is the central sulcus, like we were talking about, that is highlighted with the color blue. Then we have the marginal sulcus. So the sulcus, sulcus lying anterior to the marginal sulcus is usually the central sulcus, and the gyrus lying anterior to the central sulcus is the precentral gyrus, which is also the motor strip. Also, we can appreciate that this is the superior frontal sulcus, like we were talking about, separating the superior frontal gyrus and the middle frontal gyrus. So the superior frontal sulcus tends to form a T-shaped orientation with the central sulcus. So if we see, this is the superior frontal sulcus, and this is the central sulcus. Again, so the area that is highlighted in the color blue is the representation of superior frontal gyrus. Then we have it being separated by an orange colored line, like we can appreciate. So this is the superior frontal sulcus, and inferior to it is going to be middle frontal gyrus, which is relatively whiter. Then we can appreciate that this is the hand knob or the omega sign that can be appreciated. So this is the precentral sulcus, and this is the precentral gyrus. This is the post-central gyrus. So these are the different signs which help us to identify the central sulcus on the MRI. So this is the pars bracket sign. So pars bracket or the marginal sulcus sign tends to orient that this the sulcus that is lying anterior to this pars bracket is the central sulcus. Then this is the cortical thickness sign, that the thickness of the gyrus anterior to the central sulcus is going to be more. So we know that the motor strip has a wider, it is relatively thicker as compared to the sensory cortex. So that is why it is called as a cortical thickness sign. Then we have the omega sign, which we discussed earlier on. And this was the T sign that I was talking about, that this is the superior frontal sulcus separating the frontal gyrus, superior frontal gyrus and the middle frontal gyrus, and tends to meet the sulcus that is lying anterior to the central sulcus. So this tends to form a T with the central sulcus. So the gyrus that's going to be lying posterior to the T is going to be labeled as the motor strip or the pre-central gyrus. Again, this is the white and the gray sign that we can appreciate. So obviously, this is the area of gray matter, and this is relatively wider. Here we can appreciate anterior to the hand knob sign. So this is the identification and representation of motor strip on the MRI. Again, this is the same orientation like we see. This is also called as sigmoidal hook sign. It is also called as omega sign, and sometimes as a hand knob sign. Posterior to it is the pars bracket. So sulcus that is lying anterior to the pars bracket is the central sulcus. Here we can appreciate that the sulcus that is lying posterior to the central sulcus is obviously the post-central sulcus, and the gyrus lying anterior is the sensory cortex or the post-central gyrus. The gyrus lying anterior to the hook sign is the motor strip, which is the pre-central gyrus. And here also we can appreciate that this is the superior frontal sulcus separating the superior frontal gyrus and the middle frontal gyrus. And this is meeting just the pre-central gyrus anteriorly in a T-shaped manner, representing this is the lying posterior to it in the representation of motor strip. this is the orientation on the medial aspect of the cingulate sulcus. So here we can see this is the cavity of the lateral ventricle. This is the corpus callosum, like we can trace. So the corpus callosum is being separated from the cingulate gyrus via a callosal sulcus. Okay, and the cingulate gyrus is being separated from the superior frontal gyrus via a cingulate sulcus. So this cingulate sulcus, like we talked about, is going to have a continuation as an ascending ramus on the medial aspect, and the gyrus lying anterior to it is going to be the paracentral lobule, which is the medial continuation of the pre and the post central gyrus, and the area lying posterior to the ascending ramus is going to be constituting the precuneus, which is the medial aspect of the parietal lobe. So this is what we discussed earlier on as well. This is the color-coded highlighted aspect. This is, we are tracing this cingulate sulcus primarily all the way on the middle aspect. This is separating the superior frontal gyrus and the cingulate gyrus. And then we trace the ascending ramus all the way towards the vertex. So the gyrus lying anterior will be the paracentral lobule, and lying posterior to it would be the area of the precuneus. Thank you.
Thank you very much, Dr.
Any
Afifa.
questions? Yeah.
Any questions? Excellent talk, Afifa.
Is there any question for Dr. Afifa on this great presentation? Any question? Let's see the chat. Let's see questions, but there is many compliments and comments. Positive comments of this nice presentation and very nice images and explanation of the anatomy. So thank you very much, Dr. Afifa, for this nice presentation. And also thank you, Professor Saman, for supporting the educational courses very well. And on behalf of the Many Neurosurgical Society, I give you my deepest appreciation and gratitude for your support and your help for our educational course in the module 1 and this module also.
No, I think we owe it all to you. You do so much work. We are just there to support you whenever required, and it's wonderful that you have got excellent support with Narjiza there as well. So I think it's amazing. And I'm grateful to everybody who attended and learning so much. Like, there are things that I was revising that, there are a few things that I didn't remember from last time, and it was good to go through this again. So it was wonderful. I think everybody, I'm sure, enjoyed it.
Thank you very much. And thank you, Narjiza, for your help also. And thank you,
so
Dr.
much.
Afifa, for this fantastic presentation.
Thank
Yes,
you, Emma, for having me.
Thank you. So I think, shall we wrap up? You want to have a group photograph, or you want to finish?
Okay, we can try to take a group photograph. Let
Everybody
me
switch on their
figure out how to
videos.
do it.
So everybody
not,
switch on their videos.
Okay.
Dr. Salman, can you do it for me? I don't know how to do it. So
Yeah,
I'll make you host, and if
problem.
you can do it.
Let's get some more people to come in as well. So please switch on your videos.
Please, everyone, open your video to take a group photo of the
Come on, let's have some more people.
of attendance.
Okay.
Good.
Now we can take a photo, I think.
Right, good. So thank you very much. Let me just take a picture. Sorry, another one because there are more people joining. Okay. All right, thank you. It was wonderful as always. Ahmed, great job. And thank you, Afifa, for that wonderful talk.
Thank you very much. And thank you for all attendance. And by this, we conclude our first session and first webinar of the second module of the comprehensive neuroanatomy educational program. And thank you, everyone, and see you next Friday, inshallah.
Inshallah. Thank you. Bye-bye.
Thank you.
See you all.
Bye-bye.